Good day, everyone. This is Dr. John Ward. I'm the director of the Coalition for Global Hepatitis Elimination here at the Task Force for Global Health in Atlanta, Georgia. We're continuing our conversations with the Global Hepatitis Elimination Champions for 2020 to get to know them better and to hear from them directly the type of work they've been doing and what made it so successful. I'm joined today by Linda Zhang from Beijing in China, and she's going to be describing her work in getting connected with government authorities to address some very prohibitive regulations and laws that were really creating discriminatory practices in employment and education for people living with hepatitis B. So, Linda, it's great to see you. Please just introduce yourself. Let people know what organization you're affiliated with, and describe the type of work you're doing that led to this award. And then I'll follow up with a few other questions to go into a little bit more detail about your work.
Thank you, John, and thank you very much for recognition of my humble work. And I would like to share my practice to all people. And just a quickly brief about myself. I joined Stanford Asian Liver Center since 2011 and worked as a China program for addressing the gap of a high rate of hepatitis B and liver cancer, and especially in eliminating the stigma of hepatitis B in China. So before joining Asian Liver Center, I worked on multi-drug resistant tuberculosis in Eli Lilly, and also worked on Hepatitis Foundation of China on vaccine and education program. So that's just a very brief of my work experience.
Good. Good. Well, help me understand, as well as others understand, working at the Stanford Asian Liver Center in Beijing over that now like 8 to 9 year period, the type of work you did. Just give us the different type of work that you've undertaken over the years, as part of the Stanford Liver Center at Peking University.
Actually, yeah, in the Stanford Asian Liver Center, actually, because I worked on the whole country China program, so actually it's the same goal as of Asian Liver Center in Stanford Asian Liver Center, is address the gap which right now some resources might not reach by the local government. So we have a 360-degree outreach and advocacy, and also training and also research in China. So basically, as you might know, that in China, there still have a challenge in tackle on hepatitis B, and even there's some stigma, still serious stigma in public. And also there still have a long way on the training for the rural area physician and township hospital. So that's most of our strategy in China to focusing on.
So that's very interesting. And, just to give a little bit more background, China has one of the largest burdens of hepatitis in the world, particularly hepatitis B. I think the prevalence of hepatitis B is about 7% of the population. And the country also has the largest number of persons dying of hepatitis B, and liver cancer is one of the leading causes of death from cancer, and much of that is related to hepatitis B as well. So this has been a large problem for China for many, many years. But over the last 20 years, they've really made some remarkable progress in some key areas like infant immunization, improving birth dose coverage for hepatitis B, I'm sure there's still some work to do, and they've moved toward this triple elimination concept of, integrating it with HIV and syphilis elimination efforts to get more, make sure that women are getting screened who are pregnant so that all the right interventions are delivered to that infant to protect them from transmission, while also improving the health of the mother. But one particular problem I think we'd like to talk about for the next few minutes is this large number of people who weren't able to benefit from those vaccine policies just because they were born earlier, before those programs began. And now they're progressing, with their chronic hepatitis B. And over the years, for many, many years, I'm sure there's been social customs and perceptions that have led to, regulations that are really quite unfortunate for people with living hepatitis B. So I think just to really get into your accomplishment, give us a little background about what were some of those policies that you felt like needed to be changed, and then we'll go into how you approached working with government officials to bring about that change.
Okay, so I believe there is a will, there is a way, right? So I would like to share my personal story. It's about 20 years ago. A friend of mine, his name is Peter, and he is 22 years old, university graduated, and he is a hepatitis B carrier. And he told me he just only can afford eating noodle every day. And he did not know how long he could survive in Suzhou city. And after I knowing that, I just searched, Googled the internet, and I found out the discoverer of hepatitis B virus, Dr. Bloomberg. And I sent him letter to ask the truth of hepatitis B transmission and treatment. And luckily, after that, I got a feedback from Dr. Bloomberg and also from Stanford Asian Liver Center, the educational brochure. And I got, no, wow, that's not right. And I also gathered, so that I told my friend and a friend of friends, and we gathered about 300 hepatitis B carrier, and they signed their signature of a appealing letter. And just occasionally, because I worked in Suzhou 20 years ago, so I know there is occasionally opportunity that Suzhou mayor would participate in local enterprises health seminar. So I went there and just have a 5 minutes elevator pitch to talk to the mayor. To show the proof of Dr. Bloomberg of this is hepatitis B virus discovered, and this is Stanford Asian Liver Center's professor's proof, and also send him the appealing letter of 300 hepatitis B carrier and tell him the truth and tell them they are very excellent. If just because of the hepatitis B carrier status, you ban them is not right. The mayor, he is very wise, and he also got the truth and just lead me to the seminar and told the enterprises, those those are HR people, and tell them whether they would love to have a new recognition of hepatitis B. But I remember at that time, because the first time they just worry about that. They say, well, because the government regulation didn't change, so they need to follow. So after 2 months later, Suzhou changed their recruitment policy. And luckily, the Suzhou became the first city to ban the discriminatory practice in workplace against hepatitis B carrier. So, and the interesting thing, several years ago, I met Peter again. Now he is a CFO of a local big company and have 2 adorable and healthy daughters. So it's kind of happy ending. And I think just that story just encouraged me. I could, through this hepatitis B and hepatitis work, I can see the change I can through what I have done to help people to understand, to tie the people together.
Yeah.
So yeah, that's the main.
No,
yeah, my personal story.
that's great. I mean, that's a big accomplishment. When did that go into effect in that city? What year?
It's like 20 years ago. I believe it should be 2000, 2001 or 2002 maybe. Yeah.
So what else has changed in China in this regard? I remember, learning, some years ago that people with chronic hepatitis B had difficulty going into to the military, for example. So that's more of a national policy. So, give us a sense of have other, cities or provinces, made these kind of changes, or what's the work left to do to really get rid of these discriminatory policies?
Yeah, that's just, I'm very lucky to witness the changes, and you mentioned the regulation changes, because after that, I think, well, there was a way to communicate, as you mentioned, there's the way to communicate with the policymaker, with the experts, with patients. There should have a way to let people know they can understand that. So luckily after that, I joined Hepatitis Foundation of China. So I could have a more reach to the experts, to more reach to the policymaker. And I know the patient story. So just have many opportunities to just speak out of the problem. And also after that, because many cases happen. And actually I remember, because my personal story is 2002, in the second year, China has changed their policy actually. So just step by step,
Yeah.
and many people just like me to step out, we talk that. So, but the problem is, even after 2003, China has two regulations. One is to protect hepatitis B carriers. There should not any discriminatory practice. And another is there is a law to ban that. But until right now, there are many companies still have the discriminatory practice. In the public, they still have the wrong myth of sharing food can get hepatitis B. In the beginning, I think, wow, that's totally wrong. The policy is wrong. But further and further, I think a regulation is very easy to announce. The people's mind need to be educated. And that's what I hope in the future we need to do more.
Yeah, no, absolutely. It doesn't guarantee, society changes, but it does help. I mean, if you have that, law in place, it only, gives people another reason to continue that discriminatory practice. So at least getting the government, heading in the right direction, does, help you. It may take a little bit longer, but at least you have that as a firm starting point to really, do that other type of work to recognize the remaining discriminatory practices, and and educate and continue to let people know that those discriminatory practices are not needed, for any reason, or harmful. So it looks like it's heading in the in the right direction, in China. So what are you working on currently? What's your what's number one on your to-do list over the next many months?
Well, for us, for my point of view, still the education, just I mentioned previously, because right now the regulation has changed. So it's not law's problem. So we need to go further. Now is education. I remember right now, because we have developed a joint JADE in workplace, as I mentioned, still about 10 years past, the stigma still happen in workplace. And the regulations there, well, maybe one thing is because of the cost of breaking law, maybe not very expensive, just only several thousand RMB is fine. But still another big problem is ignorance of the public and the employee. We met a true case from one company, and the HR just found us and told us that, okay, we have shared the regulation to all of our employees, but some employee just come to us, okay, if I got hepatitis B, I will find you because of the company. You didn't have that because they are, it's kind of a supply chain factory. So the people, they stay around. So some of the employee just worry about that. So it's just to confuse the HR people. That's why we came out and we tell them, don't worry, we will help them to educate the employee. So right now we have we created joint JADE workplace zero discrimination program, which first is the company need to announce we don't have any discriminatory practice in public, not just talk themselves, they need to talk to media. And second one, if they have the commitment, we will help them to have the hepatitis B education and even help to be the bridge from them to CDC to provide their some very few free vaccine to their employee. So that's the major thing what we have done. And another major education is for the public, because right now I found only I speak out, nobody see, but maybe like you said, because you're an expert, and maybe not expert like celebrity like Jackie Chan and other celebrity talks, and people will, wow, pay attention about that. So we just engage more and more very key opinion leaders, such as experts as you, such as a celebrity like Jackie Chan, and also invite some patients to tell them story in public. Especially for these years, we have brought a big noise in communities through subway and bus stop and other social media channel to make much noise, because I found an isolated boat cannot be sailing long-term in the ocean. If just the CDC people, if just physicians people talk hepatitis B, nobody take care, especially for the policymaker. They even don't understand. So if we want to influence them, impact them, not only for the healthcare people, we need to engage more people, more impactful people. That's why these years, when we first talk to this and show the subway billboards of Jackie Chan, of other celebrities, people, I remember we have a challenge, because most of the academia, such as the China CDC and also like China Medicine Society, those physicians, because they are very, they think they are very powerful. They don't think the social mobilization is useful, because they just focus my major, okay? This is my, I'm true, you should believe in. But sometimes the lack of the knowledge of the communication. So right now, our Stanford Asian Life Center would like to be the bridge to have this interactive talk. And in the beginning, only us show in the subway with Jackie Chan to talk about hepatitis B. And after hepatitis and liver cancer. And I remember that's 2012. And right now we have engaged China CDC, WHO China, China Medicine Society, and all those like China Prevention Society, all those academia, yeah, the powerful unit, and the recognized social mobilization. So that's what we hope to in the future. In the next 5 years, we need to do more.
No, that's great. No, that's really a great body of work. That's fantastic. We really, one of the goals and missions of the coalition is to really provide a place for people to share some of their tools that they're finding useful. So I would really like to speak with you and others at the Liver Center about having a page on the coalition site and really having some links to some of that media material that you're speaking of, just so people can understand and see how the messages that you're putting forward in front of the Chinese population and just how all that's working together. So hopefully we can talk about that at a later time. I think to close, do you have any plans for World Hepatitis Day next week?
Yeah, yeah, definitely. And yeah, because this year is very unique year because of the COVID-19. So we changed all of our channel, just compare with previous year. And most of our channel is online, such as online training course. And we also, because we are in Peking University, we have a huge fans of students. But this year, because of all the campus shut down, so that's also a big challenge for us. But the one thing which help us to understand the students, they are very full of passion, and they just came out to talk to us actively. They can do their personal behavior, such as show some their education in their communities, because they stay at home, but they can share the brochure and something like that. And another thing is we have NGO funding, which is not only for hepatitis organization, but also for other, like we engage in environmental protection organization, education NGOs, because right now, focusing on hepatitis organization, I know just only two. One is China Hepatitis Foundation, and another is us. Okay. Except WHO, those kind of, but focusing on hepatitis, only two NGO. How we can done for those huge population of hepatitis B carrier. So we create NGO, we call that get together program, which engaged the other NGO to be cross-field NGO together for talking hepatitis. And that's a goal of World Hepatitis Day's meaning. So at that day, we call on all the NGOs team together. Right now, we have called on 100 and more NGOs together to talk hepatitis, to share the brochure. We send them the brochure, we send them the material, we send them. This year, we invited Huang Xiaoming, who is very famous celebrities in China. He has 600, almost, no, 60 million fans in China Weibo, like in Facebook, US. So, okay, so engage him again and to talk about hepatitis. So those are in our, and also about workplace. We for the Joint J program, because now we have engaged 32 multinational cooperate together, such as IBM, Lenovo, Apple, those kind of cooperate. And we ask them to have standard action. First, they need to send each employee a letter of WHD to show what is hepatitis, what their practice. And the second, we also share them the video and all the education material. And the third, we have some interactive action to ask their employee to write their words like hope of WHD and the main reason is we have them a survey to ask what their knowledge of hepatitis, and each employee, they need to fill that, and they will get a gift for sure to encourage them.
Sure.
So that's, yeah.
No, it sounds like sounds like a full-bodied program. No, you're approaching the problem from many different, directions, and that's the way it has to be to hit that target and create action. So I hats off to you for doing that. So no, you're doing a great job, and really just that one singular, a breakthrough event of having those discriminatory policies swept away is really, a remarkable achievement that I know you're very proud of, because of the health impact and the benefit for really hundreds of thousands of people at this point that have benefited from that. So congratulations and thank you.
Thank you so much.
Okay, so thank you again. I look forward to seeing you again, Linda, in Beijing, and look forward to working with you and everyone at the Liver Center. And so we'll be in touch about some opportunities for collaboration.
Yeah, definitely. Yeah, thank you. Thank you again.